There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
High blood pressure, commonly known as hypertension, refers to increased pressure in the arteries of the body. Pulse rate, on the other hand, is a measurement of the number of times the heart beats in a minute. As the resistance in the arteries increases due to high pressure, the heart responds by pushing less blood, which brings down the heart rate. This phenomenon is not observed in normal circumstances, since both blood pressure and heart rate tend to increase together. However, certain diseases or consumption of certain medicines that increase blood pressure can cause a corresponding reduction in the pulse rate. Blood pressure is recorded in the form of two numbers. The systolic pressure is the pressure in the arteries when the heart contracts and corresponds to the highest pressure experienced in the arteries. The diastolic pressure is the pressure in the arteries just before the heart begins to contract again and corresponds to the lowest pressure in the arteries. A systolic pressure of 140 mm Hg or more, and a diastolic pressure of 90 mm Hg or more, are indicative of hypertension. The heart pushes blood to all parts of the body via the arteries, which in turn expand and contract to accommodate the surge of blood. A resting pulse rate ranging from 60 to 100 is considered normal in adults, depending on the individual's levels of exercise, injury and illness. The symptoms for low heart rate are lethargy, breathlessness and fainting. In people who do heavy exercises, there might not be any symptoms. If there are strong symptoms, then you should immediately consult your physician. High blood pressure is also a condition that can go unnoticed until it manifests itself into situations like heart attack or stroke. Long-standing hypertension can cause failures in vital organs, internal bleeding and seizures due to swelling in the brain. Blood pressure is a combination of your cardiac output, heart rate volume of each stroke, and the total peripheral resistance in your blood vessels. Low heart rate with high blood pressure indicates high peripheral resistance, lots of vasoconstriction. A slow heart rate can be a physiological result of having a high peripheral resistance, as your body attempts to respond to the high pressure, but this is not necessarily what's happening and not possible to say what is causing it. Drugs that raise blood pressure can cause this response, as can multiple medical conditions. Having bradycardia, say bradycardia, means that your heart beats very slowly. For most people, a heart rate of 60 to 100 beats a minute while at rest is considered normal. If your heart beats less than 60 times a minute, it is slower than normal. Video here: blood pressure exercises vs LCB. For some people, a slow heart rate does not cause any problems. It can be a sign of being very fit. Healthy young adults and athletes often have heart rates of less than 60 beats a minute. In other people, bradycardia is a sign of the problem with the heart's electrical system. It means that the heart's natural pacemaker isn't working right, or that the electrical pathways of the heart are disrupted. In severe forms of bradycardia, the heart beats so slowly that it doesn't pump enough blood to meet the body's needs. This can cause symptoms and can be life-threatening. Men and women age 65 and older are most likely to develop a slow heart rate that needs treatment. As a person ages, the electrical system of the heart often doesn't function normally. Bradycardia is often the result of another heart condition, so taking steps to live a heart-healthy lifestyle will usually improve your overall health. The steps include: most people who get pacemakers lead normal, active lives. You will need to avoid things that have strong magnetic and electrical fields. These can keep your device from working right. But most electronic equipment and appliances are safe to use. Tricky to answer. High blood pressure means the heart as a muscle is having to work harder to pump the blood around the body. But you would need to look at the actual BP reading, i.e., systolic, top number, is cardiac output pressure, and diastolic pressure is cardiac return pressure. When analyzing BP, one major consideration is the difference between the two numbers. If the difference is greater, that is more cause for concern. A low pulse shows that the heart is in a rest mode or getting tired. You would have to look at the situation, medical background, local issue background, MD, etc. You would need to consult a physician and have a diagnostic checkup. This can be caused by a traumatic brain injury. What happens is the injured brain tries to swell up from the injury, but is contained by the rigid skull. This pushes up intracranial pressure, which effectively reduces perfusion of the brain by pushing against the blood flow. The body counteracts this pushback of blood by increasing blood pressure to force blood back through the brain. Now the body is operating on a higher blood pressure than is usually needed, and the heart rate drops as a part of the compensating mechanism for this.